fatigue, trouble breathing, brain fog, and blackouts. These are just some of the symptoms suffered by 1 out of 3 people who've contracted COVID. They're also 40% more likely to develop diabetes.
Well, this mysterious condition is called long COVID, and the Biden administration is now making an all-out effort to fight it. CBN medical reporter Lori Johnson explains.
While the U.S. is experiencing an uptick in COVID cases, the federal government is turning its attention to people who recovered from COVID but are left with strange, often debilitating symptoms that remain for months, even years.
But once I got COVID, and now on the other side of it, all I have now is my faith, my family, and a few friends.
Marjorie Roberts experienced a loss in quality of life when her long COVID symptoms took hold.
Losing my breath, exhaustion, a level of fatigue that I had never in my life experienced. It was just so many different things.
Shelby Boyd tells a similar story.
Being in bed for about 6 months and having just chronic pain. I had tremors. I had blackouts.
Like millions with long COVID, Marjorie and Shelby hope to recapture the life they enjoyed before COVID.
I rode horses. I was a super busybody. I'd been in the business world for the last 8 years working.
The CDC estimates 1/3 of people who had COVID-19 have lingering symptoms such as shortness of breath, fatigue, and brain fog.
There's so much interest and attention around long COVID now, as there should be, because it's affecting so many of us.
Early research shows similarities between brains affected by long COVID and those of chemotherapy and Alzheimer's patients.
COVID almost certainly affects what we call the blood-brain barrier. And as you may know, normally there's really a tight seal that keeps toxins and various kinds of chemicals we don't want, out of our brain and in our blood. But COVID seems to weaken that.
And it's not just the brain. A new study shows people who've had COVID are 40% more likely to develop diabetes within a year than those not infected.
The science is definitely starting to demonstrate this link between people who previously had COVID and increasing rates of new diabetes diagnoses.
Public health leaders say they're expanding research into long COVID to better understand its causes, potential treatment, and how to support patients suffering from it.
Long COVID is real, and there is still so much we don't know about it.
Diana Barrett founded Survivor Corps, offering support to people with long COVID.
We have over 200,000 members, and sadly, it is just growing and growing and growing. And I should also mention that children are not spared.
So while the medical community has been primarily focused on preventing hospitalization and death, they're now confronting the mysterious condition affecting people who survived acute COVID but are left with something that in many cases is much worse. Gordon?
Well, Lori, why do some people get long COVID and others don't? Is it based on how severe the initial infection is?
That's a great question, and it is one of the most perplexing questions facing scientists right now. And the answer is no. You would think that, but with all we know about COVID up until this point, that the people who get long COVID are people who are generally less healthy. That is absolutely not the case. What we're seeing is many people who are young and healthy getting long COVID, people and who even had mild cases of COVID or even asymptomatic cases are getting long COVID. Now, the symptoms and the duration, they vary, and it doesn't really affect people the same way. Some people have sort of mild long COVID symptoms, but some people's symptoms are so bad that they can't even work. In fact, Gordon, the Brookings Institution estimates that 15% of the unfilled jobs right now are due to people who have long COVID and can't work.
Well, what's the link to diabetes? Diabetes, we know, is one of the risk factors, that if you have diabetes and you get COVID, you're more likely to be hospitalized, you're more likely to die. Now we're hearing that diabetes can actually be triggered by COVID. What's the link?
That's absolutely true. And so that's one of the things that scientists are studying. There are people who are suffering all types of problems with long COVID. And so doctors really don't have a standard of care right now. They don't have a cure. But there are these post-COVID care centers, hundreds of them all over the country right now. And the Survivor Corps lists them all. And for that list, you can go to our website, cbnnews.com. There's one here in our area at Centera Norfolk General Hospital. And so one thing that they've noticed is Survivor Corps polled its members and found out that 40% of them, their symptoms went away or dissipated in a large way after they got vaccinated. So that's not a scientific study, but it was dramatic enough to warrant a scientific study right now that Yale is doing. So still so many questions that need to be answered. The diabetes questions, and so many others.
So you're saying this is sort of like shingles, that you can have chicken pox in your youth and then later develop shingles, but you can prevent it by getting a shingles vaccine. So there'll be a long COVID vaccine?
Well, they're really not sure what the vaccine link is. So there are people who had long COVID. They had COVID. They were not vaccinated. They got COVID. Then they had long COVID, and then they got vaccinated. And 40% of them, their symptoms dissipated or went away. That's not a scientific study. The symptoms could have gone away for a different reason. So that's why Yale is actually doing this scientific study. So that's one more sort of piece to the puzzle, is what kind of an influence do vaccines have on long COVID?
All right, let's talk about BA2. We've left the Greek alphabet, going back to the normal alphabet, because we've lost track of all the variants. I confess I've really let my defenses down in terms of trying to prevent getting it, on the basis that BA2 is sort of like a bad cold. The new variants aren't as severe, but at the same time, can the BA2 variant lead to long COVID? And collectively, are we walking into a real problem if 1/3 of the people that get BA2 can develop long COVID symptoms? So are we going to see a surge in long COVID because of BA2?
Well, it's difficult to predict, but we know that people who have gotten all the previous variants have gotten long COVID. So BA2 is on the rise. It's 30% more transmissible than Omicron. BA2 is actually a subvariant of Omicron. And so we're seeing an increase in cases. Philadelphia, for example, just reinstated their indoor mask mandate. Health officials expect the case numbers to start going up and possibly peak in July. A lot of people do have some level of immunity, which is encouraging, and hopefully that will protect people against severe disease and death.
Well, Lori, thanks for the insights. Thanks for the report. If you want updates on this, all you have to do is go to cbnnews.com. We want to keep you informed. And if, like me, you've been letting your defenses down, you might want to rethink that in terms of what are the implications of getting long COVID.